15 mistakes that a diabetic cannot make. Did you know that diabetes is one of the most prevalent chronic conditions in the world, affecting millions of people of all ages? Often, those with diabetes make mistakes that can worsen the condition and lead to severe complications, such as heart problems, nerve damage, and even blindness. According to experts, a significant number of diabetics do not correctly follow medical guidelines, which can put their health at serious risk. What are the 15 most common mistakes diabetics make? What are the 6 foods that can help control diabetes, and the 6 foods that should be avoided at all costs? In this video, we will address all these points, offering practical guidance and essential information so that you can better manage your diabetes. Stay until the end and discover how you can improve your quality of life and avoid complications by making smart food choices and avoiding the most common diabetes management mistakes. 15 mistakes that a diabetic cannot make. Mistake 1. Ignoring regular blood glucose monitoring. Regular blood glucose monitoring is crucial for diabetes management. Many diabetics neglect this practice, which can lead to dangerous fluctuations in blood sugar levels. It is important to measure blood glucose as recommended by your doctor and adjust your diet, medication, and exercise based on the results. Keeping a glucose diary can help identify patterns and improve control. For example, if you notice that your glucose levels are consistently high after certain meals, this may indicate that you need to adjust the amount of carbohydrates or the types of foods you are consuming. Additionally, regular monitoring can help prevent long-term complications, such as nerve damage and vision problems. Mistake 2. Skipping meals. Skipping meals can cause large fluctuations in glucose levels. It is essential to maintain regular eating habits to avoid spikes and drops in blood sugar. Plan your meals and snacks in advance and try to eat at regular intervals. Additionally, never skip breakfast, as it helps stabilize glucose levels after the overnight fast. For example, a balanced breakfast might include a serving of oatmeal, an apple, and a handful of nuts, providing slow-release carbohydrates and fiber to help keep glucose stable. Moreover, maintaining a regular eating schedule can improve metabolism efficiency and prevent excessive hunger that leads to poor food choices. Mistake 3. Consuming excess carbohydrates. Consuming large amounts of carbohydrates, especially refined ones, can raise blood glucose levels. Prefer complex and whole carbohydrates, such as whole grains, legumes, and vegetables, which are digested more slowly and help keep glucose levels stable. Use carbohydrate counting to manage your intake effectively. For example, replacing white rice with brown rice and white bread with whole grain bread can help better control glucose levels. Additionally, combining carbohydrates with proteins and healthy fats can reduce the impact of carbohydrates on blood sugar levels, providing a slower, more steady release of energy. Mistake 4. Not exercising regularly. Sedentary lifestyle is harmful to everyone, but especially to diabetics. Regular physical activity helps improve insulin sensitivity and control blood glucose levels. Try to incorporate at least 150 minutes of moderate aerobic activity, such as walking, swimming, or cycling, into your weekly routine. Resistance exercises are also beneficial. For example, adding 2 weekly strength training sessions can help increase muscle mass and improve glucose control. Furthermore, regular physical activities can help reduce stress, improve mood, and promote overall health. Mistake 5. Not following the medical treatment plan. Many diabetics make the mistake of not following the treatment plan prescribed by their doctor. This includes taking medications as directed and attending follow-up appointments regularly. Adherence to treatment is crucial to avoiding long-term complications. If you have doubts or concerns, discuss them with your doctor for necessary adjustments. For example, if you are experiencing side effects from a medication, do not stop taking it without consulting your doctor. Instead, ask for guidance on possible alternatives. Additionally, maintaining open and honest communication with your doctor can help personalize the treatment plan to better meet your specific needs. Mistake 6. Consuming sugary drinks. Sugary drinks, such as sodas and fruit juices, can cause rapid spikes in glucose levels. Opt for water, unsweetened teas, or other low-calorie beverages. If you want flavor, add a slice of lemon or some fresh fruits to the water. Monitoring the intake of sugary drinks is just as important as controlling sodas with sparkling water and lemon can help significantly reduce sugar intake. Additionally, many sugary drinks contain empty calories that offer no nutritional value and can contribute to weight gain and insulin resistance. Mistake 7. Ignoring food labels. Not reading food labels can lead to inadvertent consumption of excess sugar and carbohydrates. Learn to interpret nutritional information and check ingredients to avoid surprises. Pay special attention to added sugars and serving sizes. Products labeled sugar-free may contain other carbohydrates that affect glucose levels. For example, a sugar-free yogurt may still contain starches or other sweeteners that influence glucose levels. Additionally, food labels may contain information about sodium and fat content, which are also important for diabetics' overall health. Mistake 8. Neglecting foot care. Foot care is vital for diabetics due to the risk of neuropathy and circulatory problems. Examine your feet daily for cuts, blisters, or wounds, and keep them clean and dry. Wear comfortable footwear and avoid walking barefoot. See a podiatrist regularly for specialized care. For example, wearing cotton socks and well-fitted shoes can help prevent foot problems. Moreover, keeping feet moisturized but not overly moist can prevent cracks and infections. Mistake 9. Uncontrolled stress. Stress can affect blood glucose levels by increasing the production of hormones that raise glucose. Practicing relaxation techniques such as meditation, yoga, and deep breathing can help manage stress. Enjoyable activities and hobbies are also important for maintaining emotional balance. For example, dedicating time to hobbies like gardening or painting can help reduce stress and improve diabetes control. Additionally, time management techniques and physical activities can help reduce stress levels. Mistake 10. Lack of adequate sleep. Quality sleep is essential for diabetes control. Lack of sleep can increase insulin resistance and make glucose control more difficult. Try to maintain a regular sleep routine and create an environment conducive to rest. Avoid screens before bed and practice relaxation techniques to improve sleep quality. For example, creating a nighttime relaxation ritual, such as taking a warm bath and reading a book, can help improve sleep quality. Additionally, maintaining a comfortable room temperature and avoiding heavy meals before bed can promote more restful sleep. Mistake 11. Not treating hypoglycemia quickly. Hypoglycemia, or low blood sugar, can be dangerous if not treated quickly. Always have quick-absorbing snacks on hand, such as orange juice, glucose tablets, or glucose gel. Learn to recognize the symptoms of hypoglycemia, such as shaking, sweating, and mental confusion, and treat them immediately. For example, carrying glucose tablets in your bag can be an effective preventive measure to treat hypoglycemia quickly. Moreover, teaching friends and family about the symptoms and treatment of hypoglycemia can be vital in emergency situations. Mistake 12. Excessive alcohol consumption. Alcohol can interfere with glucose control and interact with medications. If you drink alcohol, do so in moderation and never on an empty stomach. Choose drinks with low sugar content and monitor your glucose before and after drinking. Alcohol can mask the symptoms of hypoglycemia, making the situation even more dangerous. For example, having a glass of wine with a balanced meal can be a safer choice than drinking on an empty stomach. Additionally, limiting alcohol consumption can help prevent other health problems, such as liver and pancreatic diseases. Mistake 13. Self-medication. Taking medications or supplements without medical guidance can be dangerous and negatively affect diabetes control. Always consult a healthcare professional before starting any new treatment. Non-prescription medications can interact with your current medications and cause unexpected adverse effects. For example, some supplements may contain ingredients that affect glucose levels or interact with diabetes medications. Moreover, self-medication can mask symptoms of underlying health problems, making diagnosis and proper treatment more difficult. Mistake 14. Ignoring complication symptoms. Symptoms such as blurred vision, tingling in the feet, or frequent infections can indicate diabetes complications. Never ignore these signs and seek medical attention immediately. Diagnosing and treating complications early can prevent more severe problems in the future. For example, diabetic retinopathy can be detected in regular eye exams, allowing for early treatment and prevention of vision loss. Furthermore, being aware of complication signs can help take proactive measures to protect your health in the long term. Mistake 15. Neglecting regular medical follow-ups. Regular doctor visits are essential for monitoring diabetes control and adjusting treatment as necessary. Do not skip follow-up appointments and follow your doctor's recommendations. Maintaining an open and honest relationship with your doctor can significantly improve diabetes management and prevent complications. For example, keeping a diary of symptoms and questions to discuss at appointments can help maximize time with your doctor. Additionally, regular visits allow your doctor to monitor your overall health and make treatment adjustments as needed. 6 good foods for diabetics. 1. Oatmeal. Rich in soluble fiber, oatmeal helps control blood sugar levels by slowing the digestion and absorption of carbohydrates. Starting the day with oatmeal can provide a gradual release of energy and keep glucose levels stable. Add fresh fruits and nuts for a nutritious breakfast. The soluble fiber in oatmeal, known as beta-glucan, can also help lower cholesterol levels, further benefiting cardiovascular health. 2. Salmon. Salmon is an excellent source of omega-3 fatty acids, which can help reduce inflammation and improve insulin sensitivity. Include salmon or other fatty fish, such as sardines and tuna, in your diet at least twice a week to benefit your cardiovascular health and diabetes control. Moreover, omega-3s are known to improve brain function and mental health, providing additional benefits for diabetics. 3. Spinach. This dark green vegetable is low in carbohydrates and calories, but high in vitamins, minerals, and antioxidants. Spinach is an excellent choice for diabetics, as it helps maintain overall health without negatively affecting blood sugar levels. Add spinach to salads, soups, or smoothies. Additionally, spinach is rich in magnesium, a mineral that plays a crucial role in glucose metabolism and insulin function. 4. Quinoa. Quinoa is a whole grain rich in protein, fiber, and minerals. As a complex carbohydrate, quinoa is digested slowly, which helps keep glucose levels stable. Use quinoa as a base for salads or as a side dish for main courses. Moreover, quinoa contains all 9 essential amino acids, making it an excellent complete protein source for diabetics. 5. Berries. Fruits like strawberries, blueberries, and raspberries are low in carbohydrates and rich in antioxidants, vitamins, and fiber. They can be eaten fresh or added to yogurts, salads, and smoothies, providing a sweet flavor without causing blood sugar spikes. The antioxidants in berries, such as anthocyanins, can also help reduce inflammation and improve cardiovascular health. 6. Nuts. Nuts are an excellent source of healthy fats, proteins, and fiber, which help control blood sugar levels and promote satiety. Include nuts, almonds, pistachios, or cashews in your diet, as snacks or added to salads and main dishes. Additionally, nuts contain alpha-linolenic acid, ALA, a type of omega-3 that can help reduce inflammation and improve heart health. 6 bad foods for diabetics. 1. Sodas. Sodas are loaded with added sugars that can cause rapid and high spikes in glucose levels. Replace sodas with water, unsweetened teas, or sparkling water with lemon to avoid these fluctuations. Additionally, regular soda consumption is associated with weight gain and an increased risk of developing insulin resistance. 2. White and refined breads. Baked goods made with refined flour, such as white bread and cakes, have a high glycemic index and can quickly raise blood glucose levels. Prefer whole grain breads and whole grain products for a slower, more controlled impact on glucose levels. Moreover, whole grains provide more nutrients, such as fiber, vitamins, and minerals, which are beneficial for overall health. 3. Candy and desserts. Candy, chocolates, and other sugary desserts contain large amounts of sugar and refined carbohydrates, which can destabilize glucose levels. Opt for fresh fruits or low-sugar desserts when you want something sweet. Additionally, many candies and desserts are high in trans and saturated fats, which can increase Sugary
the risk of heart
cereals.
disease.
Many breakfast cereals are loaded with sugar, even those that appear healthy. Read labels carefully and choose whole grain cereals with low sugar content, rich in fiber, for a healthier breakfast. Moreover, avoid cereals containing artificial colors and preservatives, which can have negative health effects. 5. Fried foods. French fries and other fried foods are high in carbohydrates and unhealthy fats, which can cause glucose spikes and contribute to insulin resistance. Choose baked or grilled alternatives and consume them in moderation. Additionally, frequent consumption of fried foods is associated with an increased risk of obesity and cardiovascular diseases. 6. Excessive alcohol. Consuming large amounts of alcohol can interfere with glucose control and increase the risk of hypoglycemia. If you choose to drink, do so in moderation and always with food. Prefer low-sugar beverages and monitor your glucose regularly. Furthermore, excessive alcohol consumption can lead to other health complications, such as liver and pancreatic diseases. Strategies to improve diabetes control. 1. Plan your meals. Meal planning is a powerful tool for keeping glucose levels stable. By preparing your meals in advance, you can ensure you are consuming a balanced diet that meets your needs. Include a variety of fiber-rich foods, lean proteins, and healthy fats. Use apps or spreadsheets to organize your meals and monitor carbohydrate intake. For example, planning your meals for the week can help avoid impulsive food choices that can destabilize glucose levels. Additionally, meal planning can help save time and money, making it easier to follow a healthy diet. 2. Stay active. Regular physical activity is essential for improving insulin sensitivity and controlling glucose levels. Find activities you enjoy and can easily incorporate into your daily routine. In addition to aerobic exercises, include resistance training to strengthen muscles and improve metabolic health. Remember to consult your doctor before starting any new exercise program. For example, if you enjoy dancing, consider dance classes as a fun way to stay active. Furthermore, regular physical activities can help reduce stress, improve mood, and promote overall health. 3. Manage stress. Managing stress is crucial for diabetes control. Practice relaxation techniques such as meditation, yoga, or deep breathing to reduce stress and improve emotional well-being. Find activities you enjoy that help you relax, such as hobbies, reading, or nature walks. Maintaining a positive mindset and practicing gratitude are also effective ways to cope with stress. For example, setting aside a few minutes of your day to practice gratitude can help reduce stress levels and improve your mood. Additionally, time management techniques and physical activities can help reduce stress levels. 4. Stay hydrated. Proper hydration is important for overall health and diabetes control. Drink water regularly throughout the day and avoid sugary or high caffeine beverages. Water helps maintain stable glucose levels and supports kidney function, especially important for diabetics. If you have difficulty drinking enough water, try adding slices of fruit or herbs for flavor. For example, adding cucumber slices and mint leaves to water can make it more enjoyable and encourage regular consumption. Moreover, staying hydrated can help improve digestion and skin health. 5. Monitor your blood glucose regularly. Regular blood glucose monitoring is an essential tool for understanding how your body responds to different foods, activities, and stress situations. Use a high-quality glucose meter and keep a record of the measurements. This will help you and your doctor make adjustments to the treatment plan as necessary. Do not forget to measure your glucose at different times of the day to get a complete view of your control. For example, measuring your glucose before and after meals can help identify how different foods affect your blood sugar levels. Furthermore, regular glucose monitoring can help identify patterns and trends, allowing proactive adjustments in treatment and diet. Did you like the tips? Then like this video, subscribe to the channel, and activate the bell to not miss any updates. This helps us continue bringing quality content to you. Share this content with friends and family who can also benefit from this information. Taking care of your health is an act of self-love. Thank you very much for watching and see you in the next video.